So real quickly, antidepressants. We have about 20 minutes, and this will be very short. So let's go back to the same thinking. The first thing we have to figure out is, what was the course of depression before antidepressants? You look at all the books and they say it's an episodic disorder. These people at Washington University were doing research on what do we know about the epidemiology of different disorders. And here's what they wrote. They looked back at all these hospitalization studies for the past 50 years, and I'll tell you basically what you see. Assurance can be given to a patient and to his family that subsequent episodes of illness after a first mania or depression will not tend toward a more chronic course. Why did they conclude that? If you look at studies of depressed patients going back prior to this time, hospitalized patients, first of all, 85% would be discharged within 12 months or so. That's one. So there was a sense that depression will remit, but that's a long time to be depressed. So actually one of the ideas with antidepressants was to speed up that natural healing process. And then if you look at the long-term course of hospitalized first episode patients, it goes like this. And one was done in Sweden. 50% roughly would never be rehospitalized again. There'd be another 30% that had sort of an episodic course, like every 3 years or so, they would have a severe bout of depression, might have to be rehospitalized. And there was about 20% that became chronically depressed. So this is our understanding at the beginning of the antidepressant era of the natural course of depression. Right away, clinicians start saying something. You see these notes. This is clinicians' experience who've had experience with unmedicated depression. My patients are getting better faster, but boy, are they relapsing into depression more frequently now. So are these drugs causing basically a chronification of the disorder? Then you get a Dutch psychiatrist who tests this. He compares, I think it was a 10-year outcomes of depressed patients treated either with drug or not drug. He finds more relapse in the medicated patients. And so this is 1973. What does he say? Is this approach associated with an increase in recurrent rates and a decrease in cycle duration? In other words, are the episodes coming more frequently? You see the worry arises. What happens now next in the literature? You'll see a lot of modern studies, and yeah, people are relapsing much more frequently than before. Episodes are much shorter together. In 1985, actually, the NIMH convened a panel on the course of affective disorders because they were seeing in these modern studies a lot more relapses. And here's what they said in 1985. We used to think it was an episodic disorder that didn't run towards a chronic course, but new science is showing us the true course of depression, which is in fact that it runs a chronic course. But of course, what they're seeing in the modern studies is what? Medicated depression. But they're saying it's an advance in science to see this new course. But you see in the APA textbook, my point here in this is a recognition that they used to think one thing and now they think another thing, okay, that it now runs a chronic course. This is the largest antidepressant trial ever done, 4,041 patients, and I've never seen outcomes this bad. It was done by the NIMH. It is not placebo-controlled. What happens is people came in. Everything was done to make this study look good. In fact, there's a whistleblower lawsuit based on research fraud. But if they didn't remit after on the first drug, they could go to a second drug. If they didn't remit on the second, they could go to a third, and then they could go to the fourth. And the idea was you'll eventually find a drug that works. I could go into the study design, and maybe we will later, because this study was so meant to make the drugs look good. One small thing. They had a way where they would test people every week during the initial thing. And if you were better for one day, they declared you remitted. So you could be not remitted, and the minute you remitted, then you went to the follow-up study, okay? And then they paid people to stay in the study. This was supposed to be the best care. Okay, of the 4,000, if you look at the data, only 50, and by the way, this is not severely ill. This is HAM-D of 14. This is a lot of mild illness, mild to moderate. 1,500 remitted, I don't know what that is, 38%. The documented stay well rate, the percentage of people remitted and were still in the trial and still well at the end of 1 year, was 3% of the original patients. So this largest trial did not show an effective therapy.